The movement of the tooth in orthodontic treatment is achieved by the application of orthodontic force. The ideal orthodontic force is achieved through the force of the resistance center. When the force line of the orthodontic force passes through the resistance center of the tooth performs a translational movement. However, in the actual clinical operation, the orthodontic force acts on the crown, and the orthodontic force line cannot directly pass through the resistance center to rotate teeth. According to the actual condition of the tooth, the doctor can move the tooth by applying force and torque to the tooth. The movement mode of the tooth is affected by the ratio between torque and force. At low torque, the rotation center of the tooth, is located closer to the tooth root than the resistance center. At medium torque, it will cause the translation of the tooth, and the rotation center is located at infinity. At high torque, the rotation center is located closer to the crown than the resistance center. The precise control of the center of rotation not only makes precise tooth movement possible, but also avoids bone fenestration and bone dehiscence caused by improper tooth movement, thus achieving the best treatment effect. For anterior teeth with thin labial mucous membrane wall, the proportion of positive torque needs to be applied. The intelligent rotation center can be placed at the cervical area of the labial side tooth to control the crown's rotation and simultaneously move the root into the alveolar bone. This method can be safely and effectively used to apply torque control and anterior tooth intrusion and reduce the difficulty of orthodontic treatment for some deep overbite cases. In different cases, the application of the intelligent rotation center varies. For anterior crossbite correction using clear aligners, it often requires proclination and intrusion. At this time, the intelligent rotation center can be placed in the resistance center, which is towards the root, and is suitable for anterior crossbite cases where the labial side bone wall is thick. With the rotation center close to the incisal edge, it can reduce the relative intrusion, and vice versa. When relieving anterior crossbite using traditional fixed orthodontics, during the anterior proclination after leveling the occlusal plane, anterior extrusion is inevitable because the arch wire controls the vertical dimension of the crown. Through invisible clear aligner treatment, there's a significant relative intrusion on the anterior teeth during proclination, which helps to relieve the anterior teeth crossbite of patients in the early stage of orthodontic treatment to avoid occlusal trauma and reduce discomfort during chewing.